Turmeric might be the most overhyped spice on the internet. Today, we will cut through the noise, real numbers, real studies, and exactly how to use it for maximum benefit, plus when to avoid it. I'm Dr. T, Food Safety and Public Health. This is a deep dive grounded in peer-reviewed research. We will look at what curcumin, the star compound in turmeric, and actually doses in the body. What outcomes clinical trials have shown, how to combine it with black pepper, and practical ways to use it in the kitchen and as a supplement safely. Turmeric is the spice from Curcuma longa. Curcuminoids are a family of polyphenols in turmeric. Curcumin is the most studied member. Culinary turmeric is 2 to 5% curcuminoids by weight, often about 3%. The turmeric powder contains roughly 60 to 150 milligram curcuminoids. The key problem is the curcumin is poorly water soluble and undergoes rapid first-pass metabolism. So little reaches the bloodstream unless formulated or combined properly. Let's talk about how it works, the mechanism. It works as anti-inflammatory. Curcumin can dial down inflammatory signaling, especially NF-κ, leading to lower expression of COX-2 and LOX and the pro-inflammatory cytokines. It directly scavenges reactive oxygen species and regulates the body's own defenses via increasing enzymes like HO1, SOD, catalase, and glutathione synthesis. And it also can affect the metabolic effects, small but meaningful effects on lipid like TG and low-density lipoprotein and glycemic markers in some trials, likely via reduced inflammation and improved insulin signaling. It also affects the gut and bile flow. It may influence the microbiome and support bile secretion, which is one reason to take it with fat for better absorption. Let's talk now about how actually benefits. First of all, let's talk about knee osteoarthritis. Multiple randomized trials and meta-analysis show modest pain reduction and improved function versus placebo, with fewer GI side effects than non-steroidal anti-inflammatory drugs in head-to-head comparison. What it means that if you have mild to moderate knee osteoarthritis and can't tolerate non-steroidal anti-inflammatory drugs, a standardized curcumin extract may be worth discussing with your doctor. Now, we're gonna talk about the metabolic health. In people with metabolic syndrome or fatty liver, curcumin has shown improvements in ALT and AST, small reduction in triglycerides and low-density lipoprotein, and sometimes better insulin sensitivity, most consistently when higher bioavailability forms are used for 8 to 12 weeks. Now, we're going to talk about the general inflammation and soreness. Active people sometimes report less DOMS, post-exercise soreness. Effects are variable and depends on doses and forms. Now, let's head to the black pepper question. Why pepper helps? Piperine from black pepper can slow curcumin metabolism by inhibiting UGT enzymes and BGP, boosting its short-term blood levels. In one human study, 20 mg piperine taken with 2000 mg curcumin increased measured bioavailability by about 20 folds for the first hour. That spike is transient. A pinch of black pepper with turmeric is sensible. Add a fat source like olive oil, eggs, milk, yogurt to aid absorption. Turmeric plus fat plus pinch of pepper is the best combo. Now, let's head to what is the exact dose and how to use it. Let's talk about food first. Daily cooking target is half to 1 teaspoon turmeric powder, which equals 1.5 to 3 grams of curcumin with meals. Pepper, you can add 1 over 16 or 1 over 8 teaspoon freshly grounded black pepper, which equals 0.3 to zero point 0.6 gram. For fat source, cook in 1 to 2 teaspoon oil or pair with whole fat, dairy or plant milk. And of course, split it across meals for consistency. Now we will talk about supplement ranges for adult. Curcumin extract standardized to 95% curcuminoids, about 500 to 1000 milligram per day divided with meals. If your product doesn't include piperine or an enhanced formulation, consider 5 to 20 milligram piperine alongside, or use a product that already combines them. The duration is typically 8 to 12 weeks before reassessment. Let's talk about safety interactions and who should avoid it. General spice use is widely considered safe. Most issues arise with high-dose supplements and especially enhanced absorption formulas. For liver safety, there are rare cases of supplement-induced liver injury. Sometimes, when turmeric is combined with pepper or piperine, if you develop a jaundice, dark urine, severe fatigue, or right upper quadrant pain, stop and seek care. And for bleeding risks, curcumin and piperine can affect platelet function and drug metabolism. Use caution with anticoagulants or antiplatelets like warfarin, clopidogrel, non-steroidal anti-inflammatory drugs, and before surgeries. And for drug interactions, piperine may increase levels of drugs metabolism. Always check with your doctor. And for gallbladder, bile issues, avoid high doses if you have gallstones or bile duct obstruction, unless your doctor approves. And for kidney stones, turmeric is high in oxalates. If you form calcium oxalate stones, avoid mega doses. And for pregnancy and breastfeeding, the food amounts are fine. Supplement doses aren't well studied. Avoid unless your doctor approves. Now, in a high absorption golden scramble. The recipe serves for only 2 whole eggs plus 1 teaspoon of olive oil. This is the fat source. And half teaspoon of turmeric powder plus pinch of black pepper freshly grounded. Quarter teaspoon of garlic powder, quarter teaspoon of paprika, salt to taste. And optional, you can add quarter teaspoon of ginger. Squeeze a lemon at the end. The method here: warm oil, bloom turmeric and spices 10 to 20 seconds, but don't burn them. Add eggs, finishes with the lemon. White works because fat, pepper, heat activation of aroma compounds is the best. You can also use curcumin as a beverage when you make golden milk. 250 ml whole milk or soya or oat milk plus half teaspoon turmeric and a pinch of black pepper, sliced fresh ginger, simmer for 5 minutes, and optional you can add honey. The rapid fire question and answer. First of all, can I just eat and get the benefits? For sure, when you use turmeric in food is great for long-term health habits, for specific outcomes, for osteoarthritis, pain. Question number 2, pepper upsets my stomach, so what then? Use food plus fat and consider an enhanced formulation without piperine. Always check the drug interactions. Question number 3, what is the best time to take? With meals or split doses along the day? And finally, how long until I feel something? Trials often report changes after 8 to 12 weeks. Finally, turmeric or curcumin can help some people, especially with knee osteoarthritis and metabolic risk, but it's not a miracle. For better absorption, food plus fat, a pinch of pepper, or a quality enhanced formulation. Know the risks and interactions, monitor your own outcomes, and involve your healthcare team. Like and subscribe, share with someone who loves spices and has some medical issues. Thank you for your time. I'll see you soon in another medical tip.